Good day. So in today's video, I'm going to talk about a condition which is Polycystic Ovary Syndrome or abbreviated as PCOS. So what is PCOS? Polycystic Ovary Syndrome or PCOS is a condition in which the ovaries produce an abnormal amount of androgens, which is also known as the male sex hormones, that are usually present in women in small amounts. So the name Polycystic Ovary Syndrome describes the numerous small cysts, fluid-filled sacs that form in the ovaries. So as you can see here in the photo, in the left side of the ovary, you can see red dots that represents the cysts that formed. Moving on, let's talk about what are its causes. So first is insulin resistance. Many women with PCOS have insulin resistance. This means that the body can't use insulin well, and when the body can't use insulin well, insulin levels will build up in the body and may cause higher androgen levels. Obesity, on the other hand, can also increase insulin levels and make PCOS symptoms worse. Lastly, genetics may also run in families. It is common for sisters, mothers, and daughters to have PCOS. What are the symptoms? So, the symptoms of PCOS may include missed periods, irregular periods, or very light periods, ovaries that are large or have many cysts, excess body hair including the chest, stomach, and back, or the condition is also called hirsutism, weight gain especially around the belly or the abdomen section, acne or oily skin, male pattern baldness or thinning hair, infertility, small pieces of excess skin on the neck or armpits, or these are also called as skin tags, dark or thick skin patches on the back of the neck, in the armpits, and under the breasts. How is PCOS diagnosed? There are several ways PCOS can be diagnosed. Your healthcare provider will ask about your medical history and your symptoms. You will first have a physical exam. This will likely include a pelvic exam. This exam will check the health of your reproductive organs, both inside and outside your body. Some of the symptoms of PCOS are like those caused by other health problems, and because of this, you may also have tests such as ultrasound and blood tests. Moving on, how is PCOS treated? If you do plan to become pregnant, your treatment may include a change in diet and activity and medication to cause ovulation. On the other hand, if you do not plan to become pregnant, your treatment may include birth control pills, diabetes medication like metformin, a change in diet and activity, medication to treat other symptoms. What are the complications of PCOS? Women with PCOS are more likely to develop certain serious health problems, and this includes type 2 diabetes, high blood pressure, problems with the heart and the blood vessels, uterine cancer, and infertility. So when do we seek medical help? So if you missed or irregular periods, excess hair growth, acne, weight gain, call your doctor for an evaluation. So if the previous mentioned symptoms are evident in your body, so it is the best timing that we call for a medical help. What are the key points that we need to remember? So these are the key points. PCOS is a very common hormone problem for women of childbearing age. Women with PCOS may not ovulate, have high levels of androgen, and have many small cysts on the ovaries. PCOS can cause missed or irregular menstrual periods, excess hair growth, acne, infertility, and weight gain. The types of treatment for PCOS may depend on whether or not a woman plans to become pregnant. So for women who plans to become pregnant in the future may take different kinds of medication than those who don't plan to have a child anytime soon. Lastly, women with PCOS may be at higher risk for type 2 diabetes, high blood pressure, heart problems, and endometrial cancer. So these are the next steps that we need to take. Tips to help you to get the most from a visit to your healthcare provider. Before your visit, write down questions you want answered. Bring someone with you to help you ask questions and remember what your provider tells you. If you have a follow-up appointment, write down the date, time, and purpose for that visit. At the visit, write down the names of the new medicines, treatments, or tests and any new instruction your provider gives you. Lastly, know how you can contact your provider if you have questions. So this ends my discussion about polycystic ovary syndrome or PCOS. So these are the references or the resources for my discussion.